I'm just wondering what you're planning.
I'm actually behaving. I'm actually behaving. She actually has a plan. I've never done this. I normally don't love this. I want to make sure I want to do it.
Do you think we ought to tell the panelists to move up? Just let them go from where they are. Everybody's kind of toward the front.
They said they're wrapping up an interview back there somewhere.
They had the, what do they call it, 7 to 4, the 4 at 7.
Get into the program tonight, I've been tasked with making an announcement that there's a black minivan at the building across the street, parked near a dumpster in the drive-thru, and they would like it to be moved if the owner of that could help us out. So thank you all for coming this evening. My name is Miller Brantley. I'm on the County Board of Supervisors, and I'm going to be your MC this evening. Tonight's conversation is about improving access to health care in the Allegheny Highlands. The Allegheny County Board of Supervisors has identified access to health care as a goal and a priority for this year, and we're very pleased and thankful to have this opportunity to work with Clifton Forge Community Gathering to deliver tonight's program. I want to say a special thank you to Courtney and Ken and those who really made this possible tonight. I think it's a good turnout, and I'm happy you're all here. So we're going to start with a presentation from the Allegheny Highlands YMCA and Live Well Allegheny Highlands, followed by Lewis Gale Allegheny, and then a panel discussion moderated by Courtney Howard. So let's get started. If you'll join me in welcoming Dr. Sandra McHenry and YMCA Director Bobby Wagner to share more about the Live Well Allegheny Highlands program.
I might need to lower this just a little bit. Good evening, everyone, and thank you all for being here, especially on a rainy night. As the CEO of the Allegheny Highlands YMCA, I have the privilege of seeing both the strength and the challenges of our community every single day. The Allegheny Highlands is a place built on resilience, hard work, and deep relationships. People here genuinely care for one another. But we also know that living in a rural community can make access to healthcare more difficult than it should be. For many families across the Allegheny Highlands, healthcare is not just about having insurance or finding a doctor. It's about distance, it's about transportation, it's about long wait times, limited specialists, and the reality that preventative care often takes a back seat to work, caregiving, and everyday responsibilities. In rural communities, people often delay care until a health issue becomes serious, not because they want to, but because access can be very challenging. And when healthcare access is limited, the effects ripple across the entire community. It impacts physical health, mental health, educational success, workforce stability, and overall quality of life. A healthy community is not simply one with hospitals and clinics. A healthy community is one where people feel supported, connected, and empowered to live well every single day. That's where the YMCA can play an important role. The YMCA has always been more than a gym. At its heart, the Y is a community health and connection organization. We're a place where people of all ages, backgrounds, and income levels can come together to improve physical health, strengthen their mental well-being, and build meaningful relationships. In many ways, the Y serves as a connector for our community. We connect children to positive role models. We connect seniors to friendships and programs that reduce isolation. We connect families to resources, support systems, and healthy opportunities. We connect community partners, healthcare providers, schools, and local organizations to create stronger networks of care throughout the Highlands. And in a rural area, we all know that those connections matter tremendously. Isolation is one of the greatest hidden health risks facing rural communities today. Many people, seniors living alone, this could be young families under stress, teenagers struggling with anxiety, adults managing chronic disease. They simply just need places where they feel welcome, supported, and encouraged. The Y is often that place. When a child learns healthy habits through youth programs, we're investing in lifelong wellness. When a senior joins a fitness class and gains strength, mobility, and friendships, we're helping prevent injuries and improve quality of life. When families have access to affordable recreation, wellness programs, swimming, nutrition education, and community spaces, we're helping prevent chronic illness before it begins. And importantly, we work hard to ensure that those opportunities are available to everyone. At the Y, we believe in health and wellness should never depend on someone's financial situation. That's why we proudly offer financial assistance to those individuals and families who qualify. Whether it's a child participating in youth programs, a senior attending wellness classes, or maybe just a family needing access to healthy activities, we want every person in our community to know that the Y is here for them, because access matters, dignity matters, and no one should feel excluded from opportunities to improve their health and well-being just because of financial barriers. None of us can do this work alone. That's why hopefully all of you are here. The future of rural healthcare depends on strong partnerships. Hospitals, schools, nonprofits, businesses, faith organizations, community leaders all have a role to play. The Y can help bridge those gaps by creating trusted, accessible spaces where people feel connected to resources and to one another. Imagine a community where preventative health screenings happen regularly, where mental wellness programs are as common as fitness classes, where chronic disease prevention programs are available close to home, where children grow up understanding healthy lifestyles not just as a privilege, but as a normal part of life, where older adults remain active, independent, and socially connected longer. That vision is possible, and in many ways, it's already happening here. At the Allegheny Highlands Y, we are committed to helping create healthier, happier communities by strengthening both individual wellness and community connection. We want to continue being a place where healthier choices become easier choices, where people feel seen and valued, and where everyone has the opportunity to thrive. Healthier communities are happier communities. Happier communities are stronger, they're more resilient, and they're better prepared for the future. The challenges facing rural healthcare, they're very real, but so is the opportunity before us. If we continue working together with compassion, collaboration, commitment, we can improve the health and well-being of families throughout the Allegheny Highlands. At this time, I'd like to introduce a fellow member of our Y team to share more about the work that's happening through Live Well Allegheny and through multiple partnerships of many of you sitting in the room tonight. Dr. McHenry graduated from the University of Kentucky and University of Kentucky College of Medicine. After practicing neurology in Kentucky, homeschooling 3 kids, and more recently teaching anatomy and physiology at Mountain Gateway Community College, she now serves as a Healthy Highlands program leader at the Allegheny Highlands YMCA, working to support health and wellness across the entire region. Please join me in welcoming Dr. Sandra McHenry.
Thank you. Good evening. I have been tasked with telling you about the Live Well Allegheny Highlands Steering Committee. And that's a mouthful, so I'm going to say Live Well or the Live Well Committee. The Live Well Committee has been around since about 2017, 2018. And as many of you all know in here, it consists of representatives from different health-related organizations, plus our schools, our hospitals, I'm gonna stop naming because I will leave someone out. It also consists of some just individuals from our community. What LiveWell is tasked with is putting together the community health assessment and the community health improvement plan, what we lovingly refer to as the CHA and the CHIP, or the CHA chip. The community health assessment, put very simply, is data. Just a bunch of data. But there's no point in having data if you're not going to do something with it, and that's what the plan is all about. LiveWell Allegheny consists of the representatives from different organizations that we have in our community, plus the Virginia Department of Health. And I don't want to leave them out because they are sort of the backbone. They supply us with the infrastructure, a lot of resources, Excel spreadsheets, and all sorts of good stuff that we can't really do on our own. And Emma Duff is here tonight. She is my partner in this endeavor. I am the chair of the committee. I don't know that she has a title for our committee, but we like her. We're going to keep her. We do have some paper copies of the CHA out on our table. If you would like to take one, there's a few. And at the end, I have a QR code that you can scan, and it will take you to the BDH webpage where you can see it. Next slide. Here's the timeline. We started working on this current CHA chip cycle in August 2023. This is our second CHA chip. We had one previously, and the cycles go every 3-ish to 4 years, depending how productive we are. This current cycle started with looking at different questions we wanted to ask the community. So that's part of the data that we did. We did a community survey, 15 questions related to health, healthcare, some demographics. In addition to the community survey that we put out, which we call the primary data, we have secondary data, and that was gathered by Emma. Thank you. The secondary data consists of things from the CDC, VDH, surveys done statewide and in different communities, anywhere we can get reliable data about the health of our region. So we have the primary data and the secondary data. And then in April 2024, we did a community data walk. You literally walk around and look at the data. And we met a few times after that as a committee. There's usually about 20 of us that meet together and looked at that data and said, well, what do we do with the data? We wanted to name some priorities that would focus our efforts over the next 3 or 4 years. And we got together and we picked 2 priorities based on what we were seeing in the data. The first priority is chronic disease, and the second priority is mental health and substance use disorder. So we identified those 2 priorities. Then we split up into work groups, and that's where we've been for about the past 9 months, I guess, is 2 different work groups. I've been on the chronic disease work group. Some other folks in here have been on the mental health and substance use disorder work group. In the work groups, we have come up with goals, and we'll get to those in a minute, but we have to have goals, we have to know where we're going, and with the goals, we have different strategies. So next slide. Now this is the boring part. I'm gonna show you some data. It's mostly bar graphs. I like bar graphs. I'm not a data person, but bar graphs are easy to understand for me. This is a couple of questions from the community survey. So this question, people were asked, top 5 factors influencing health. So they had a choice of factors that they could choose from. And these are the top 5. There was a tie for 5th place. First is aging. Aging problems. People are worried about aging, same. Lack of physical exercise, poor eating habits, access to healthy foods, environmental health, and tobacco use, smoking, vaping. So remember that. Number 2 and 3, lack of physical exercise, poor eating habits were in the top 3. Okay, next slide. So now they were asked conditions impacting their health. These were actually diagnoses that they have, diseases, actual conditions. And these are the top 5 responses. High blood pressure or hypertension was number 1. overweight, obesity, stress, diabetes, and cancers. So note again, number 2 is overweight, obesity. Okay, next one. Now I'm going to get into the secondary data. That was the primary data. This is the secondary data. When looking at healthcare data, we do it by localities. We have 2 localities in the Allegheny Highlands, Allegheny County. So you're in Allegheny County right now. You thought you were in Clifton Forge, but you're in Allegheny County. That includes Clifton, Iron Gate, Lowmore, Selma, and then Covington City is its own locality. Okay, next slide. Most of what you're going to see now, I don't have a lot, don't worry, but there's going to be different bar graphs. On your left, we get Allegheny County, Covington City in the middle, and Virginia on the far side there. Age-adjusted % of adults in poor physical health. Now let's explain age-adjusted. This is a data statistic thing. So if you had 2 different populations, and let's say one was older and the other was younger, and you're looking at heart disease. Well, of course, the population that's older is going to have more heart disease. That's not really a reliable result because you're looking at apples and oranges. So the data people come in, they wave their magic wand, they put things into a formula, and they come up with what is called age-adjusted. So that now the 2 populations represented are of similar ages. Don't ask me how, I'm a biology major. So a lot of this is going to be age-adjusted. And this shows poor physical health. So people were asked in the last month, did you feel like you were in poor physical health at least 14 days? That was the question. And I've got Virginia up there kind of for comparison. We'd like to be as good as the state of Virginia or even better. Unfortunately, in most things, we are not. So next slide. This is obesity. Remember, obesity was one of the concerns with people. In Allegheny County, almost 41% are obese, and this is a BMI greater than 30. I don't think the state of Virginia has much to brag about, though. Okay, next. High blood pressure or hypertension. Again, we're a little bit above the state of Virginia. Both of our localities, pretty close. Next. And I will tell you, you're seeing this data that goes through maybe 2021, 2022. The reason you're seeing it that way is because, remember, we started this CHA-CHIP cycle in 2023. So this is the data we looked at to determine our priorities. And I did last night, for like 3 hours, look at some of the new data. It's not much different. Hypertension and or renal disease mortality rate. A lot of renal disease is related to hypertension. So this is a mortality rate. Often mortality rates are done over 3 to 5 years, so that if you have like 1 year, you had an abnormally number of people dying from a certain cause, that wouldn't screw up anything. You want to do more of an average. And it's done in a rate per 100,000 population. Another thing about data. This data tells us what? It doesn't tell us why. I don't know why. Okay, next slide. Coronary heart disease. Coronary heart, seems redundant, but coronary heart disease. Both localities are higher than the state of Virginia overall. Next slide. Heart disease mortality. Again, I don't know why there's this difference between our 2 localities, but that's what the data shows. Next slide. Chronic lower respiratory disease. This is all your COPD, asthma, chronic bronchitis, all of those. And we are pretty high compared to the state of Virginia. Next. Malignant neoplasm. So these are solid tumor cancers like lung cancer, brain cancer, bone cancer, not leukemia or lymphoma. And again, both localities are above what Virginia is, and Covington City is higher. Alzheimer's disease mortality. I don't know why, but that's what the data shows. We are an aging population. 26% of people in Allegheny County are over 65, 20% in Covington are over 65, compared to Virginia, which is 17%. This is a cause for concern because not only do we have folks who have Alzheimer's or other types of dementia now, we will probably have more. And not only do they need care, their caregivers need care. Okay? All right, let's look a little bit at mental health. The question was, did you have 14 or more days in the last month where you felt like you had poor mental health? And both of our localities are about the same, but still higher than the state of Virginia. Depression. This is people who were told by a clinician that they have depression. Okay, next slide. All right, this one looks a little different. This is suicide-related emergency department visits, and this is the only one I have that reflects youth. This is 5+, and they've put Allegheny County and Covington City together, but that's a little bit alarming. Next slide. All drug overdose death rates. The orange line is Covington City, blue is Allegheny County, the dotted or dashed is the state of Virginia. And while some of these are a little different in the next couple of years, they're not that much different, and Covington City still is higher than the other two localities. Next slide. Okay, so we had the data, and this only represents a fraction. The CHA is 110 pages, and I've chosen not to show you all 110 pages. But we have the data, and then we sat down and said, what are we going to do with the data? So that's when we started thinking about why. Why is it like this, and what can we do about it? And part of it, trying to answer why, is we're looking at risk factors. These are not all the risk factors, but these are some of the main risk factors for many of the chronic diseases and also mental health and, of course, substance abuse issues. Genetics. Okay? We can't choose our parents. We can't do much about genetics, but certainly if you have heart disease, you don't want to smoke. Or if your parents have heart disease, you don't want to be a smoker because that's going to increase your risk significantly. I have my mother's bunions. I don't wear pointed toed shoes. Smoking, vaping, nicotine. If you can do one thing for your health, it's stop smoking, stop vaping, and quit nicotine. Alcohol, poor nutrition, poor physical fitness. Remember that when we asked people what some of their main concerns were, nutrition and physical fitness were very high on the list. And then socioeconomic factors. So these are things like low median income. Low median income correlates with poor physical health. These are also things like your neighborhood. It also includes what we call ACEs, adverse childhood. I can't remember if it's a, what? Experiences, thank you, because I keep saying events. But ACEs would include things like growing up in a home with domestic violence or being a victim of child abuse. Those types of things. Those things increase your possibility of having mental health and substance abuse disorders and being in poor physical health. We can do some modifying of those, but not everything. So after genetics, these other things are what we call modifiable risk factors. So we looked at those and said, what can we do as a community? What do we have the resources? So we're looking at all the organizations sitting around the table. What resources do we have, and where can we have the most impact? And thinking about all the chronic diseases we looked at, I didn't show them all, but we saw heart disease, hypertension, of course obesity. When we looked at them, we said poor nutrition, physical activity. If we hit those two things, we can affect all of these chronic diseases. And that's how we decided, how we came up with our two priorities, chronic disease, mental health, and substance use disorder. Next. All right, so now we're getting into the CHIP, the Community Health Improvement Plan. Right now we are in this plan. We are putting together strategies. We've implemented some strategies, and this plan will continue through 2027-ish. So we have these three goals. Number one is foster a culture centered on community wellness and healthy living. Now, when I say culture, what I mean is community habits, the habits we have as a community. Habits are contagious. And if I see someone out there who is running, walking, exercising every day, they're feeling good, they're eating right, I'm gonna look at, and I'm gonna look at them and say, wow, I really wanna be like them. I want those habits. And that's part of what we wanna do, is create this culture by showing people what they could be doing to make themselves better, physically and mentally. The second one is education programs and resources. I may know I need to eat better, but what do I eat? How much do I eat? I need to exercise. How much? What kind of exercise? How do I exercise without hurting myself? I got out of bed the other day and twisted my ankle. Goal 3, reduce barriers. So a lot of what you're talking about later, what I call taking care of your health. By taking care of your health, you don't have to worry as much about health care. So if we put this together, I call it educate, educate, motivate, facilitate. Educate, motivate, facilitate. I should have had Emma rearrange these for me so it would be in the order that I wanted them to be in. Okay, next. On the other priority, substance use disorder and mental health disorders. Goal 1, judgment-free mental health and substance use disorder resources. It's 2026. People are still afraid to reach out because of the stigma associated with substance use and mental health. And that's a barrier, and we want to change that. Expand resources offered in the community. Already, in just the last couple of years, and not really, we hadn't even started the CHIP yet, but resources have expanded. CSB has a mobile crisis unit now. They're building a whole new facility for people in mental health crises. And Nicole, I know you agree with me, an emergency department is the worst place for someone in a mental health crisis to be. They need to be in a different environment. In the last few years, we've had to recover Virginia over in Covington. You can just walk in and talk to somebody. You don't even need an appointment. Just walk in and talk to somebody. These are the things that have just happened the last few years that we want to build on. And number 3, prevention programs. CSB has 3 people that are literally called the prevention team. And they work very hard with prevention with regards to substance use. Next slide. Okay, so what have we been up to? This is the interesting part. This is the fun part. These are some of the things that we have ongoing related to our CHIP. It's not everything. I didn't have all the pictures. Next. This has to do with the chronic disease side. Clifton Connects project is being funded by the Virginia Walkability Action Institute. If you're from Clifton, if you know anything about Clifton, the roadway from Clifton Woods, Mountain View down to CVS and Kroger, a lot of people use that and they walk that roadway. It is not safe. It is not a safe place to be. And this is working to make that safer and more accessible. That's doing 2 things, making the community more walkable, better physical fitness, and also getting rid of a barrier. Because if you can't go get your groceries, if you can't go get your prescription, because you don't have other transportation, you have to walk there, then this is taking away a barrier. Okay, next. Community nutrition classes. Emma and I were just at a conference and got some what we call flash funding to do some nutrition programs in the community. Dr. Yum's Adventure. Love Dr. Yum's Adventure. We started this in our early learning centers last year. The kids love it. You see a picture of it there. I believe this is the day they made a beet shake. They're trying different fruits and vegetables. It's a 2-year curriculum. They get introduced to a fruit or a vegetable every month. And the good news is we are well on our way to getting this implemented in the schools for the 4-year-olds. Next one. Mountain Toppers Healthy Aging, a pet project of mine. But this shows what our organizations do when they collaborate. This is being done by Allegheny Highlands Regional Library, YMCA, and Connections Plus. Once a month, we go in, we have a senior group. It can be up to 45 people. They are the rowdiest people you've ever seen. We do something fun, we do something educational, and then we feed them lunch. Here we have Eric Gutierrez from Bath Community Hospital talking about healthy brain habits. In the middle is Catherine May from Lewis Gale talking about added sugar. And on the far side we have Matthew Clayton from the YMCA showing them some things they can do at home for strengthening and balance, and he showed them a variety of things. And the point of that was that you don't need to belong to a gym to stay healthy, to be physically fit. Sorry, Bobby, don't know where you are. Next one. But we do want you to join the Y because that's where all the fun people are. Mental health and substance use disorder, bullying prevention. Okay, for the last 3 days, there's been a play for all the 5th graders in Allegheny Highlands Public Schools, all 4 schools. I've seen this play 8 times now. I had to miss it today. But it's a bullying play. It's about 25 minutes. They talk about bullying during the play. And then Eric Gutierrez, the counselor from Bath Community again, he goes up and talks to the students for about another 15 or 20 minutes about bullying, ways to prevent bullying, what to do if you are bullying, if you are being bullied. It's a really good presentation, and we want to do it in the fall to the new 5th graders. There are some discussions ongoing between CSB and some other organizations with our EMS to try to get resources to individuals sooner, and also trying to decrease stigma around calling EMS and dealing with EMS. Next one. Another pet project, okay. When you have the spotlight, use it. This is a grant from Virginia Foundation for Healthy Youth. YMCA does this with CSB. April's going, yay! We go into GRTC and the high school, do education around vaping, tobacco, nicotine. JRTC marketing class, Jody Burgess's marketing class, also does a marketing campaign. They've made several graphics for us. This is the logo made by one of their students. The good news is that next year, fingers crossed, we'll be in the middle school. Next one. Oh, this is upcoming. Little plug for the Tall Cop. And for more information, please see April Miller back there, but he will be here Thursday, August 6th. And if I'm not mistaken, this is primarily for parents and adults to know what their kids are doing, what to do about it. From
so they know what's going on here.
Yes. He's going to go around to the different vape shops.
Yes.
Yeah. And see what is there and come back and tell us. So we don't have to go in the vape shops. Next, I think that's it. Oh, no, that's not it. This is the most important thing. We need you, okay? Some of you are already involved, but we need more partners. We need more organizations. We need more people. We need more localities. We want to work with you for these 2 priorities I've pointed out: chronic disease, mental health, substance abuse. So if you have an idea, well, we can make this a more walkable area. Let's hear it. Let's see how we can get some funding. Let's do it. Community needs. Well, we don't know everything the community needs. We're just a group of people that meet once a month, but we don't always know what individuals in the community need to have done. So we need to know that. And last, but maybe most important, funding. Funding is always key. If you've seen something, if your organization or a business can fund something, some of these initiatives are not that expensive, okay? Okay, so $1,000, $3,000 can get you a lot, okay? It can get you a lot. Or maybe you just want to buy a meal for an education program. Yeah, we need that too. So any sort of funding, Emma is always looking for funds. She is our grant goddess. Next. Okay, this is the last one, I promise now. The first QR code up there will take you to the page where the child lives. The chip isn't published on it yet. This QR code takes you to the best website ever. It is a portal for data, and you can put in what you want to see by locality, and it will create an assessment for you. It's the neatest thing. So the Virginia Wellbeing Data Portal. I am right on time. Thank you so much.
Thank you both for those wonderful presentations. We certainly appreciate your continued efforts for the betterment of this community. So next, I am going to invite Nicole Tucker and Aaron By from Louisville Hospital Allegheny to come up. Nicole serves as the Chief Executive Officer and Chief Nursing Officer at HCA Louisville Hospital Allegheny here in Leavenworth. An Allegheny County native, Dr. Tucker's got about a leadership style rooted in accountability, innovation, and meaningful community partnership. Under her leadership, Louisville Hospital Allegheny is entering an exciting period of transformational growth, expanding its reach into West Virginia, scaling specialty care programs, and fully leveraging the strength and capabilities of HCA Healthcare to position the organization as the premier destination for rural healthcare across the region. Aaron Weiss serves as an Assistant Administrator, Ethics and Compliance Officer at Louisville Hospital Allegheny. Aaron, a Covington native, began her career at Louisville in March 2017 as Patient Access Director and transitioned in 2025 to the role of Assistant Administrator, continuing her commitment to leadership and organizational growth. Aaron is also actively involved in the community, serving on numerous boards and committees, including the Allegheny Highlands Chamber of Commerce, and the Healthy Youth Coalition. I can invite them up.
Good evening. It's an honor and a pleasure to be here with so many community partners, and an honor to be here with my partner, Aaron By. Aaron and I are both Allegheny County natives. We love this area, we love this community, and we're excited to see how we can partner and transform to make our area grow and to take care of our community right here at home.
I don't know how you follow Sandra McHenry, but we'll do our very, very best. All right.
So we've introduced ourselves, but we wanted you all to see the faces behind the other leaders at Louisville Hospital Allegheny. Our leaders, again, are hometown. They are from here, love here, and are committed to making our hospital the best hospital that it can be. Angela Reynolds, our Chief Financial Officer, many of you have worked with her. She's actually from White Sulphur Springs, West Virginia. She is housed at Louisville Medical Center, and she partners with us to cover our facility. Obviously, you met Aaron. Eddie Parham is our VP of Human Resources. Caitlin Dixon is our Behavioral Health Director. Michelle Hilton is the Quality Director. Tom Elmore is our Co-ECO and Imaging Services Director. And Katie Elmore is our Director of Clinical Operations, meaning she has med-surg, ICU, cardiac, pulmonary rehab, along with respiratory therapy.
All right, so HCA, Louisville Hospital Allegheny is part of HCA, which is the largest healthcare corporation in America, hence the name. And so we have 190 hospitals total, 2,500 ambulatory sites of care in 20 states and the UK. So many folks don't know that we have sites in the UK as well. In total, we have more than 300,000 colleagues located all across the world. And access to data, which is so important. It helps us grow, helps us learn where the needs are. 45 million patient encounters contribute to that data that makes our care very good. And just to show you a little bit about HCA in the state of Virginia, so we're obviously a part of Southwest Virginia. We have 4 hospitals there, Northern Virginia, and then Central Virginia. So this just shows the layout and where we are located throughout our state. And we are sorry, I couldn't see that far. The 5th largest employer in the Commonwealth of Virginia and the 4th largest employer in the Allegheny Highlands.
We're part of Capital Division, and Capital Division is headquartered out of Richmond, Virginia. HCA as a whole is headquartered in Nashville, Tennessee. But being part of Capital Division, we also have 4 hospitals in the state of New Hampshire. We did have Terre Haute Regional Hospital, which I had the pleasure of serving at for 2 consecutive years. in Indiana, but we did divest that. A large system very similar to Carillion that was able to step in and partner, and it's a 2-campus system now, so really great for that community. When you look at the Louisville Regional Health System and HCA as a whole, again, we are the largest healthcare corporation in the United States. We're the 10th largest employer in the US, and we are a top 100, a Fortune 100 company, which brings sustainability to us as a system, but also to our local economy. So when you look at us, we have 4 hospitals and 3 freestanding emergency departments throughout Southwest Virginia. And we talk about access points in rural health, that's very important. A lot of people think that you have to receive your care at a hospital, but when you live in a larger, more urban or metropolitan area, the access point of a freestanding ER is vitally important to receive emergency care. When you look at the financial impact of Louisville Regional Health System, it's $434 million, and Louisville Hospital Allegheny, we're proud to say, is almost $26 million. Last year alone in our community, and that includes the greater Greenbrier I gotta start over. I'm having a stroke, Sandra. The greater Greenbrier Valley, it was $23 million in salaries, wages, and benefits to our employees. Over $1 million in state and local taxes, and we're proud that we served uncompensated care of over $1 million, right? Insurance does not matter. If you're sick, you come. We have programs, we can take care of this community. You cannot put a price on human life.
All right, so every morning we start out with a mission statement. We live our mission every single day. It's above all else, we are committed to the care and improvement of human life. I do have that memorized. And so in 2015 or 2025, 15% of our employees volunteered across the community, and we talk about community partnerships, and that's something we really strive for. We encourage volunteering throughout. We've been at most of the representatives' facilities in here. We have a program with HCA called Your Cause, and so it's a way to encourage our employees to volunteer. If you volunteer a certain amount of hours and you log that in the system, it gives us a stipend that we can give back into the community. So say I volunteered at one of the local schools for a few hours, I get $200 that I can give back to either the schools or the Humane Society or a different location throughout the community. So it's just a way to encourage our employees to get out and be a part of the community.
Per employee, that's up to $1,000 per year. So with 264 employees, that could be $264,000 that we put back into the charity of our choice here in the Allegheny Highlands.
So as you can see up there, Nicole and I are a part of pretty much every group in the Allegheny Highlands, and we're really, really proud that we've been invited to be a part of these groups. We feel it is very important to represent. I won't read all of those, but if you go to the next slide, we also have the rest of our executive team and what they are a part of. So just another way that we're giving back to the community by being a part of these boards and encouraging our teams to do the same.
So when we talk about recognition and what occurs, it's important to highlight the hard work and the diligence of our employees. So last year, we were honored to be named the 2025 Chamber of Commerce Large Business of the Year. And while Aaron and I accepted that award, it's the 264 colleagues we have, plus over 100 physicians in our network available to us that really take care of our patients and really earn this award. So we would like to say thank you to Josh and the team, and to those who voted for us and support us, because we want to continue to be here and sustainable in this community. Also, again, we're a Spring A Leapfrog performer. The Leapfrog is an independent company that rates hospitals based upon patient safety and quality indicators, and we're consistently a Leapfrog A performer, as well as a CMS 3-star performer. I think you all know that the federal government is heavily involved in reimbursement throughout our country, and it's a pay-for-performance system, and that's really a great thing. The government says if you are saying that you're providing a service, you have to provide it, and we get to measure you on it because we're reimbursing you. And when you look at our aging population and the socioeconomic status, we're about 65% Medicare, 14% Medicaid, the rest is commercial or managed care. We have to be taking care of our older population, the people that have worked to create our community, and we have to give back to those people. And I think that it's a good measure that we're able to show the things that we do. So when we look at the benefits of HCA, two things that you all are probably very curious about is how we address shortages of providers as well as nurses. And I venture to say that Greg and Jane look at the same things in their entities. How do we do that? And so for HCA as a whole, we have the largest GME, or General Medical program in the US, where we have residents. And each year it's about 5,000 residents that we can help them through their residency and then help place them in our system. Not all residents stay, but we as a company are fortunate that we've helped close that gap. And what incentives can we provide to have quality physicians come out of our programs? And HCA literally has every specialty across the US that we can help somebody align with. So that's more graduates than any other healthcare system. And at Louisville Medical Center, we have a program, and we have about 75 residents currently here in the market.
So this slide really is to introduce our new general surgeon that we have here and kind of talk about how we got him. So sometimes recruiting in small rural areas can be extremely difficult. So every 3 years we do what's called a community needs assessment, very different from a CHA, but similar in a way that it shows where our deficits are, what providers are lacking based off of our population. So it takes our population, the age of our population, what providers are in the area, and it's general area, not just employed by us or on our campus. It tells us where the deficit was. We had a long-time general surgeon that retired, so we knew that we would have a deficit with general surgery. We interviewed probably 10 or more general surgeons until we found the right one. So happy to introduce Dr. King to you. So he's been with us since February, March, and has fit in very, very well with the community and has a really interesting background. So I'll let Nicole tell you about that.
So Dr. Kang spent 25 years in the US Navy. He's deployed to 5 continents. He was a naval flight surgeon. And his claim to fame, he was actually on the aircraft carrier that they brought Captain Phillips back to after the Somali pirate incident. He is international, national. He just really meets our patients where they're at. And I think you all know in rural America that's very important to be able to get on a patient's level. Dr. Kang removed my gallbladder April 1st, and it was a pleasant experience as one can have. So, highly recommend.
Something else that we take really seriously is the impact of the hospital and the providers and get feedback from them. So we do that with our employees, but we also do that with our providers, and that helps us be better for them and better for our patients. So every year we have a 2-week period where we survey our providers, but we also celebrate our providers. And so this just shows, and you guys can see some of the familiar names up there, the providers that won the awards this year, and it's voted by our employees, which I think is really neat. So they nominate and vote on the providers that they want to win. And if you'll go to the next slide, I'll show you a couple pictures so you can see the faces. So Dr. Mays up there, who also spends some time at Bath, we're happy to share him. He won one of our awards. Cassie Hall, just a lot of really shining faces. Melanie Hinkle helps a lot with our women in healthcare. She's our cardiology PA. Dr. Daniel is a native of the Allegheny Highlands. He is our ER medical director. He won our ER award this year. Very happy to have him on the team. He helps a lot with EMS and different things, and has just been a really great leader for us. And I heard somebody say, we all know who Dr. Pack is, so you can pick him out up there.
So the strength of what we do is really our people, and we can't say it enough. Having an engaged, vested workforce is paramount to the sustainability of any organization. And so this is the other side. We've talked about closing the gap on physician recruitment. Really the nursing side. We all know that throughout the U.S. there has been a nationwide shortage of nurses. And so we are very happy to partner with Mountain Gateway Community College as our primary partner for nurses. Dr. Kathy Haller is on our board, and I serve on the board at Mountain Gateway for the advisory committee for nursing, and that's a really wonderful partnership. We have a program within the hospital where second-year nursing students can actually work as nurse externs, do additional skills, and earn an income while they are learning. We go on to employ many of those nurses, and our second primary partner is actually Galen College. So Galen College was actually founded by Humana in 1989 in Louisville, Kentucky. In 2020, HCA purchased the Galen School of Nursing, and we now have campuses in over 8 states. Our campus in Roanoke, it's on Electric Road, it's the former Allstate building at Kagi Village, is actually the second bricks and mortar in Virginia, and that is really helping close the gap in Appalachia. So we partner heavily with both, and both schools are really paramount to our hospital.
So technology changes every day, especially in healthcare, and so we have had to learn how to adapt with that. One of our biggest opportunities was our electronic medical record system we had since the beginning of time. It was called Meditech. If anybody's ever worked for an HCA facility, they know what that is. And so recently, based off of feedback from our providers and our staff, we were able to upgrade to a new EMR. It's called Expanse. It took a year of planning, 6 months for implementation, and then one night at 9:00 p.m. we flipped the switch and everything changed. And so we've been adapting to that. It's gone really, really well. Our providers seem really happy. Our staff seem happy. There's an AI piece of that that has assisted our providers with making thorough notes and making sure that we're doing what's best for our patients. And this is just a really great picture. The night that we kicked off, we had corporate and division and all kinds of folks there.
So by 2029, all HCA facilities will be live on Expanse. This is a $2.1 billion product by HCA, and it was over $5 million into our local hospital that was invested. So when we talk about care like family and scope and scale and what we do as the HCA, but really uniquely Louisville Hospital Allegheny, besides volunteering and taking care of our community, there are times that there have been natural disasters. You see Mission Hospital here, and this is a group of ladies at the airport. But our company is able to mobilize. So if we had a natural disaster here and we needed a generator or two, within 24 hours, HCA would bring that in for us. We go to the Mission story when Hurricane Helene came through. There was no water, there was no power, there were no wells, there was nothing in North Carolina. And HCA went in as a company. We took corporate engineers and we drilled wells. We opened the hotel back up. We made mobile laundromats. We set up a grocery store for the entire town. And we were really there in Western North Carolina for a natural disaster. So Hurricane Katrina was another huge catastrophe in the U.S. that HCA was very present for. These things happen and they're unfortunate, but we are glad as a company that we're able to support. We actually had 2 nurses that flew to Florida and were able to redeploy to help when there's a need. So, Aaron and I, we appreciate you all. If you have any questions, we'll be here after the presentation. Any of you are invited to come see us, have lunch with us, tour our facility, and meet our people. So thank you.
Thank you both for that presentation. We appreciate you both and your staff for what they do for this community. services that they often provide. So if I may now ask our four panel members to join us on stage, I will turn this over to Courtney Howard, who's going to moderate this panel, and she will introduce our panelists. Thank you all.
Thank you, Miller, for handling the first part of our event here. I'm going to go ahead and start introducing our panelists while they're getting settled and introducing themselves to one another. And I am, like you said, Courtney Howard. I am the supervisor for Clifton Forge West on the County Board of Supervisors, and I'll be moderating this panel. And the panel is based on, our questions are based on a survey that we put out to the area residents. So you might hear a couple of statistics from those survey questions at some point. So we have a very strong panel tonight. Dr. Scott Just, Greg Madsen, Dr. Jane Russell, and Tasha Walsh. Dr. Scott Just assumed the role of Chief Executive Officer of UVA Physicians Group in May of 2023. Dr. Just practiced emergency medicine in Central Virginia for 23 years. He earned his bachelor's degree in chemistry from Hampton-Sydney College. He then earned his medical degree from the UVA School of Medicine and completed his residency in emergency medicine at UVA Medical Center, where he served as chief resident in the Department of Emergency Medicine. He also earned a master's in business administration from UVA's Darden School of Business. Just is a member of the American College of Healthcare Executives, a fellow with the American College of Emergency Physicians, and a graduate of the American Hospital Association's Next Generation Leaders Fellowship. Greg Madsen serves as the administrator of Carilion Rockbridge Community Hospital, which is part of Carilion Clinic. Mr. Madsen joined Carilion in February of 2016. Mr. Madsen oversees all clinical and facility operations at Carilion Rockbridge Community Hospital. He also represents Carilion Clinic in neighboring communities such as Allegheny County, the city of Covington, and Bath County. Before joining Carilion, Mr. Madsen served as CEO of 2 HCA hospitals, Spotsylvania Regional Medical Center from 2014 to 2016, and Lewis Gale Hospital Allegheny from 2008 to 2013. Prior to that, he served in executive leadership roles at St. John Hospital in Kansas and Tenet Healthcare facilities on the West Coast. Mr. Madsen has served on the boards of a number of organizations, including the Allegheny Highlands Economic Development Corporation, the Allegheny Highlands Chamber of Commerce and Tourism, the Virginia State Chamber of Commerce, and the Community Foundation of Rockbridge, Bath, and Allegheny. Mr. Madsen is married to Kelly Dean Madsen and has 2 children. Dr. Jane Russell is a nationally respected healthcare executive with more than 25 years of experience leading rural and critical access hospitals. She brings deep expertise in hospital operations, strategic service development, and patient-centered care. Before joining Bath Community Hospital as CEO last year, Dr. Russell served as Chief Operating Officer at Samaritan Pacific Communities Hospital in Newport, Oregon, when the hospital earned recognition as a 2023 American Hospital Association Rural Health Leadership Finalist. Her career also includes leadership roles in Alaska, where she guided healthcare delivery for tribal communities and remote regions. Dr. Russell earned her Doctor of Pharmacy from Creighton University and an MBA from Western Governors University. She is board certified in oncology pharmacy and brings both clinical insight and operational expertise to her role. She is committed to advancing Bath Community Hospital's mission of delivering high-quality, accessible care to all patients. Tasha Walsh is a licensed clinical social worker and a professional certified coach who has been working in the integrated healthcare field for more than 30 years. She is the CEO of Connections Plus Healthcare and Hospice, which was formed by the joining of Mountain Regional Hospice and Rockbridge Area Hospice. Tasha is committed to assuring high-quality advanced illness, dementia, and end-of-life care can be delivered in the places we call home. So now we're going to head into our panel discussion. And like I said, some of these questions come from a survey that we did, and the survey actually had over 115 responses. So we were very proud of that. I'm going to direct these questions to start off with from like certain individuals, but if you have any thoughts that you want to add in at the end, feel free. So the question number 1 is addressing travel burden and regional access. Over 80% of survey respondents report traveling outside of the region, often 50 to 200 or more miles for care. Respondents cite OBGYN, pediatrics, cardiology, pulmonology, and surgical services as the types of care that they are traveling outside of the region to receive. What specific services could realistically be brought back or expanded locally to reduce this travel burden? And what barriers currently prevent that? And I'm going to start this one off with Dr. Russell.
Does this work? Oh, there we go. Thank you. Well, I think that one of the areas that might surprise you, because I think when I met with Ken, he didn't know this, but in Covington, Bath Community Hospital and Bath Community Physicians Group does have a pediatric practice. So here in the audience, we have Dr. Joseph Ott, who is a board-certified pediatric physician, as well as 2 APC providers that have full pediatric panels. So for pediatric care, we actually are in Covington and we are raring to go. So please send patients our way. As far as other things, you know, having worked in rural communities my entire career, one of the things that I think is across the board the same is travel for care. One of the things that happened that actually was a silver lining out of COVID was the ability to really transform healthcare in looking at telemedicine, right? In Alaska, we've been doing it for 40 years, right? Because you can only fly in and out of where I lived and then 50 communities. So it was really part of the infrastructure. And I know that there's work actually happening in rural Virginia to help expand that, because I think part of it is infrastructure. And then the other component actually is reimbursement, right? So one of the things that I've been doing is talking with our representatives saying, you know, not everyone has to see their doctor face to face. Now, sometimes they do, but not for every visit. And so how can we reduce the burden on rural people and make sure that they don't necessarily have to drive those long distances? Right now, because in hospitals we have expenses, right? So you have to pay the salaries no matter what people are doing. And so the reimbursements, other than behavioral health, have been reduced with the reductions of the waivers that happened during COVID. So I've been working with Chris Runyon to talk to him about that, because he's actually on a panel to see if we can elevate that discussion, because I think that that's a big barrier. Because again, a lot of hospitals, especially rural hospitals, are operating at negative margins, right? We do. And so if it's bringing the patient to you because you don't have the infrastructure that you need to pay, and telemedicine does have, you know, costs with it associated as well. So I think that the other component is the rural health transformation grants that are coming out. One of the areas that we're looking into, and I think there are some organizations that do it really well, but I think you're going to start seeing more of this, is the paramedicine program, and taking your local EMS providers to send them out into the communities to help people so that they can check in on them, people that may necessarily need to come to the ED quite a bit because they don't have a lot of care at home, or they might get nervous. We can send them out, as well as other opportunities. And as we mentioned, you know, looking across, right now, our hospital is really focused on partnering with a lot of our skilled nursing facilities to be able to send our actual providers into those facilities to help with wound care, to help, again, go to where the patients are at versus trying to bring them to us. And so those are a few of the things that we're doing. Realistically, as I mentioned earlier, we cannot sustain a lot of high-cost, high-end specialty care in rural hospitals. And one of the reasons is not just because, you know, we don't, you know, want to pay for them to be there, but the reality is when you look at, for instance, in my last hospital, we had 3 OBGYNs, so we delivered babies. We delivered about 280 a year. and you have to have 3 physicians because you can't have them on call all the time. Well, having 1 in 3 call is very difficult for physicians. Work-life balance, I'm sure you'll talk about that a little bit. And so it's a struggle to keep people there because they're on call constantly. And then the other thing they worry about is keeping up their skill set, right? They've gone to all this training, and if you don't use it regularly, you really do lose your level of skill. And so we don't necessarily want some of these specialties in our areas because they would lose their ability to provide those types of services. So I will stop there. I'm sure that other folks have a lot of input on this.
I'm happy to chime in. I think that was a nice assessment, and someone turned the lights up so I can't see you anymore. It's very bright. But congratulations for your commitment to improving your community's health. I think that you should be applauded for that, and thank you for the invitation to be here to talk about it. One of the things that we're trying to do at UVA Health, I agree, it's very hard to have specialties for everything in every place. There's just not, the demand is greater than the supply. Is using telehealth. And in existing physician offices, for example, OB, you may have to travel occasionally to see an obstetrician or to deliver your baby, but perhaps you could have a virtual visit with a primary care provider in the community with an obstetrician or a maternal fetal medicine physician if you had a complicated pregnancy. And so we're trying to extend the reach of those specialists into the communities. We believe that the best care is care closest to home, and that's where our patients want to be, and it eliminates some of the transportation burden. I'll also say on the non-physician or provider side that there are many, many community resources which you've heard about tonight. The challenge for us, and I think the challenge for many communities, is knowing where those resources are, what those resources are, how to access those resources. And when you think about transportation, there are coalitions of community members who help transport patients in many communities, and that may exist in your community. But I think that that's one thing that I would explore on how to help provide transportation. Now, there's 2 different types of transportation in my mind. There's long distance transportation to see a specialist, but there's also challenges within the community of getting from your home to the practice, the physician's office, or the hospital. And one thing that we have started to roll out into our community are mobile clinics, where we're taking the provider and the service and the nurses and the social workers into the communities where we know there are transportation challenges, and sometimes there are trust challenges with patients may not want to come into the hospital. So I think that's a nice alternative and option if you have the resources to bring something like that to the community.
Do you have an order that you want us to go in?
No, if you'd like to speak, you're welcome to.
Is this on? It is, okay. Again, I'm Greg Matson. I'm pleased to be here, and Nicole and Aaron, I'm so glad to see that hospital in great hands. It's the hospital that brought me here, and I really appreciate what you're doing for it. And I appreciate being up here with all of you as well. At a macro level, my first experience in healthcare was like downtown Los Angeles. I worked right by Cedars-Sinai. I saw every town had every physician on every corner, and that town did. So throughout my career, I kind of moved east and east, and I found myself here in Allegheny. I see Dr. Crandall's silhouette. He interviewed me. And he said, Greg, you know, it's an adjustment coming here, but if you stay for a while, you're going to like it. And it was true. There's an adjustment period, and I was kind of overwhelmed by the difference in the dynamics of this community versus places I've been before. I thought Kansas City was a small town of 3 million people, and I came to Allegheny. Came to Virginia, and I've worked in 3 hospitals, all with very different circumstances. So I came here. This is kind of a rural industrial town with its own flavor. HCA oftentimes moves its CEOs around. I went to Spotsylvania Regional, which is like a DC suburb, and there are doctors everywhere. It's like high density. You don't really need to recruit. You just need to sort of redirect physicians to your hospital. And then I went to Carillion 10 years ago, which is in many ways more of a physician group than a hospital company. We have a medical school and we kind of train our own. We have a research institute, so doctors come to research, teach, and practice medicine. And this is an overgeneralization, but I don't really have to recruit because Carillion's medical group kind of repopulates itself and deploys to our different communities, and all the specialties that you mentioned over the last 10 years, we have added all of them. We have 4 OBGYNs, we don't do deliveries, we do the GYN piece, we have full-time pediatrics, full-time, most everything. That's in large part due to the clinic model that we have, which is very attractive to, I think, today's physicians. But coming down to this, this is an Allegheny-centric conversation here. Dr. Russell talked about the economics of specialty practice, and I think one of the unknowns, and in the question, I think an underlying theme is, tell us what we don't know. Give us a peek under the tent here. And one of the truisms, I think it's true for all the hospitals, that employing a specialty physician requires a tremendous investment. In my career, we've gone from a very independent practice of medicine, much like Dr. Crandall's practice was for many years, to an employed model where the doctors expect to be paid the same in DC as if you bring them to Allegheny. And so in a rural community, there's less population, more government payers. Most government payers pay below your cost. Hospitals can't really raise their net revenue because Medicare is just not going to pay that. So you have this compression of revenue and these limited resources, and then you get into the volume issue and not being able to keep an OBGYN busy with enough patients to justify it. So it's a real conundrum, but I think it's admirable if you think about the positive. We're sitting here in Clifton Forge. I see the mayor up there. You got Lewis Gale Allegheny, 5 minutes. You got Bath Hospital, I can get there in 40 minutes, going fast. I can go to my place in 35 minutes. You've got Greenbrier Valley, I know it's now a critical access hospital, not too far, and then in the surrounding area, UVA, Roanoke Memorial, Lewis Gale Salem. You have an enormous abundance of healthcare. I know you have to drive, I know it's a big question, but there are resources we should feel blessed to have. Carillion very much wants to provide access to care in all the communities we serve, Rockbridge, Allegheny to the extent it's collaborative with our local partners, and I always advocate for our presence to expand in all these areas. And I do want to go into the legislative advocacy, but I'll stop there, maybe save that for a second question.
Okay. All right, I'm going to move on to the second question, which I'm going to direct to Mr. Madsen. And you kind of touched on it a little bit. So residents consistently cited shortages of primary care physicians and specialists as a top concern. The Allegheny Highlands Economic Development Corporation has a physicians recruitment grant program for physicians who moved to the Allegheny Highlands to reside and practice medicine in the Allegheny Highlands. What additional strategies should we consider to recruit and retain physicians and specialists in the Allegheny Highlands, or maybe even how can we promote that current program better if people don't know about it?
I love that question. I'm currently on the Economic Development Board, and I helped design that program, which involves Lewis Gale Allegheny and 2 members of the EDC board, and we helped a Bath physician, I believe, get one of those grants recently. So I'm very familiar with it, and it's funded by the Allegheny Foundation. My wife is chair of that foundation, so it's all very tied together for me. And I think we just need to keep those funding sources available to the extent they help doctors relieve their medical debt. But I think fundamentally, it's up to the employers who are going to be the drivers of bringing primary care here. Telemedicine is a big opportunity. I think it is wonderful. We have Carillion Now. I can go on my phone, click on Carillion Now, and have a doctor take care of me virtually to the extent that's possible. But HCA is a employer, Carillion's an employer, Bath Hospital's an employer, UVA, and insurance companies around the country employ physicians. So I think we all have to be advocates to the powers that be within our companies to identify the highest and best use of our dollars to employ doctors in primary and secondary communities. And Carillion right now has hired Kaufman Hall, which is a consulting company, to help us really design the right medical model for the entire Southwest Virginia for Carillion Clinic. So we're making smart use of our dollars, and I constantly advocate for this community to kind of enter this in a way that's productive. I do think telemedicine, like Dr. Russell said, is going to only grow. Some aren't comfortable with it, but I think it's going to become more of a new normal. And I think government advocacy, legislative advocacy at the state and federal level is going to be key, because what is funded gets provided. And I know we'll go more into that in future questions. But.
Would you mind explaining to us what the recruitment grant program is through the EDC?
Yes, and there's a whole document. Ken McFadden is well aware of it, and Tyler Sizemore sort of administers it.